So let's talk about x-rays and what your orthodontist is looking for. So you have an idea when you go into your orthodontist kind of what they're looking for, and if you have any issues, you'll be better equipped to handle them. So this is one that we call an impacted canine. You can see the arrow pointing to the tooth there. It's this tooth right there. So you can see it crossing over this other one. If you leave it there for too long, it might cause damage to your adult tooth, so that's something we want to look at and take care of. Next up is a little syndrome called Eagle syndrome on the stylohyoid ligament. It calcifies, and then you can see it in the x-ray. So we're going to look at your condyles. So on the edges of the jaw, your condyles. At age 11, 28, these are two different x-rays taken of the same person. They were able to notice condylar resorption, so the condyles of the mandible, your joint, had resorbed or broken down. Here's an interesting one. You'll see this tooth floating over here in this big water balloon. That is a dentigerous cyst, and it is a form of cyst, so it's there right in the mandible, in the jaw, and it's eaten away the bone. It's kind of exploded out. Just think of a water balloon filling up with fluid. So this one looks a little different than the last one. Here is a tumor there in the jawbone. These are calcifications in your carotid arteries. This is obviously an older patient, but these are kind of things that we can see in x-rays. This is osteonecrosis. The bone there is dying or resorbing. You can see how shrunken it is at the red arrow versus the opposite side. Have you ever wondered if your septum in your nose is deviated or not? Your ortho can see it in your orthodontic x-rays at your ortho visit. All right, a lot going on here. On this one, we can see all of these extra teeth. These are supernumerary teeth. The opposite of that last slide, missing teeth. You can see the two arrows. The baby teeth are what is still there because there's no adult teeth to take the place. So last one up here, you can see on these two areas, these little specks right there. Those are similar to the calcifications that you saw before in the neck at the carotid arteries, but these are actually tonsillits or tonsil stones. So calcifications within your tonsils, those can cause bad breath, but they will show up in our x-rays.